Hello again, and welcome to session number two, titled Normal Cervical Anatomy. In this session, we will be learning more on the gross cervical anatomy as well as the microscopic cervical anatomy. The importance of this lesson will be towards the identification of the transformation zone, the old or the congenital squamocolumnar junction, and the new squamocolumnar junction. It is on this area in the cervix that you find the precancer. And that because we will be using a colposcope soon, you will appreciate the structures better magnified compared to using unaided via, meaning just the use of your eyes.
The cervix is a fibromuscular organ that connects between the uterus and the vagina. It measures about 3 to 4 centimeters in length and about 2.5 centimeters in diameter. There is a canal inside the cervix called endocervical canal, and cervical tissue surrounding the endocervical canal is called endocervix. Ectocervix is the outer part of the cervix protruding inside the vaginal lumen. The opening between the cervix and uterus is called internal os, while external os is the opening between the cervix and the vagina.
What do you think will be the significance of learning again anatomy? Well, it said that whenever you get pap smear samples, then you need to get specimen from both the endocervic and ectocervic. Understanding what it is, you now know where to get these samples at.
The inner surface of the endocervix is irregular, formed of peaks and inward foldings. These inward foldings are called endocervical crypts. On the other hand, the ectocervix has a smooth surface. Now let's examine the epithelial lining of the endocervix. As you see, the endocervix is lined by a single layer of columnar cells. These columnar cells contains basally located nuclei. There is also a less clear layer of cells called reserve cells. Reserve cells are present under columnar epithelium inside cervical stroma. And here is a histologic picture of the endocervix, where you can see the single layer of columnar cells with basally located nuclei. And these two arrows are pointing toward reserve cells. The function of reserve cell is to divide and multiply, forming new columnar cells to replace all the degenerated ones. In fact, reserve cells are bipotent. I mean, they form columnar epithelium, and under certain circumstances they can form squamous epithelium. There are blood capillaries inside the villous part of the endocervix, and these blood vessels are separated from the surface by a single layer of columnar cells. These features of the endocervix, I mean the irregular surface, and the blood vessels are separated from the surface by a single layer of columnar epithelium. These features will give the endocervix its characteristic colposcopic appearance. Under magnification, it looks like a red grape-like structure. Now let's examine the epithelial lining of the ectocervix. Ectocervix is lined by stratified squamous epithelium. Stratified means multiple layers. Resting on the basement membrane, a single layer of cuboidal cells with large nucleus are present. These cells are called basal cells and forming basal cell layer. Here is a histologic picture of the basal cell layer, where you can see the cuboidal cells with large nucleus. The function of basal cells is similar to the reserve cells of the endocervix. I mean, they divide and multiply. When basal cells divide, the older ones will move towards the surface. And during their movement, they will become larger, forming a new type of cells called parabasal cells. There are about 5 to 10 layers of parabasal cells forming parabasal cell layer. With increasing maturation, the intermediate cells are formed, which occupy about 15 to 30 layers, forming the intermediate cell layer. Here is a histologic picture of the intermediate cell layer, which contain light cytoplasm and small nuclei. With increasing maturity, the superficial layer will be formed, which contains squamous cells. Squamous cells are flat cells with abundant cytoplasm and very small nuclei.
Just short of a review, the endocervix, yung nasa loob, is composed of a single layer of columnar cells. This is why it appears redder in color, kasi one layer lang. The ectocervix will appear light pink due to its multiple layer. The reserve cells are bipotent, meaning it can transform to either columnar cells or squamous cells in certain conditions. So ano siya, ACDC or chick boy, no? Pwede siyang pang chick, pwede siyang pang boy. And this is unlike that of the ectocervix. Now, the endocervical canal under magnification will appear like grape-like structures because its surface are irregular, bako-bako. Again, unlike that of the ectocervix, which should appear smooth.
Now let's examine the junction between squamous and the columnar epithelium. It's formed during fetal life, and that's why it's called original or congenital squamo-columnar junction. It's an abrupt junction with no transition between the two types of epithelium. I mean, once squamous epithelium ends, columnar epithelium will start. The location of squamo-columnar junction is variable because during the times of excess estrogen, the cervix will grow and consequently will evert. The cervix will grow and consequently will evert, bringing a part of the endocervical tissue outside the level of external os. Eversion is simply defined as the presence of endocervical tissue outside the external os. This everted part of the ectocervix is known as ectropion. Now the columnar epithelium of ectropion become exposed to vaginal medium. This columnar epithelium is sensitive to the acidity of vaginal medium and will be damaged and replaced by squamous epithelium in a process known as squamous metaplasia. Metaplasia means transformation of one mature form of epithelium into another mature form of epithelium. And in the cervical condition, it means transformation of columnar epithelium into a squamous epithelium. Squamous metaplasia is a patchy process. I mean, it starts initially in the crypts and at the tips of the villus part. Then they fuse together. Squamous metaplasia has 3 stages. Stage 1, called reserve cell hyperplasia, when reserve cells under columnar epithelium start to divide. Second stage, when reserve cells proliferate to form multiple layers of immature, undifferentiated parabasal cells. And still a layer of columnar epithelium can often be seen on the surface. This stage is called immature squamous metaplasia. The last step is a stage of mature squamous metaplasia, where immature cells differentiate into mature squamous epithelium, which nearly cannot be differentiated from the original squamous epithelium.
Another point for you to understand is that the squamous and columnar junction is variable or dynamic in position in each phase of a woman's life. The reason for this is the hormone estrogen. In the presence of estrogen, the columnar epithelium or the columnar cells are protruded outside of the cervix, meaning lumalabas. And in its absence of the estrogen, the endocervix regresses to hide sa loob, so not visually seen from the vagina. Let's take examples here. So first, during fetal life, because estrogen is high, the endocervical epithelium is protruded outside the endocervical canal. This junction regresses later during prepuberty. So the endocervical epithelium hides inside the endocervical canal at this time. Now, when the child starts puberty, so estrogen hormones increases na naman. It then comes out again. This junction between the squamous cell of the ectocervix and the columnar cells of the endocervix is called the original squamo-columnar junction. Now, the protruding endocervical epithelium will later be subjected to the acidity of the vagina and will go transformation from a columnar cells to epithelium cells called squamous metaplasia. This is a normal process. And when this happens, the space between the old and the new columnar junction is called the transformation zone. Shown on this slide is a pre-ascetic and post-ascetic where to the unexperienced would diagnose this as cancer, where this is a normal process called squamous metaplasia. When the patient later approaches menopause, then the levels of estrogen decreases. So the endocervical epithelium recedes again into the endocervical cavity. At this stage, VIA will no longer be the ideal in women where the new squamocolumnar junction can no longer be seen or appreciated. Perhaps a pap smear would do better for this at this time.
And now, a new squamo-columnar junction has been formed. And the area of epithelium that develops squamous metaplasia is called transformation zone. In other words, the transformation zone is defined as the area between the original and the new squamo-columnar junction. Transformation zone is the area where most, if not all, cervical cancers develop, and it is characterized by two features. Number one, endocervical crypt openings. Here is a colposcopic picture of transformation zone where you can see the opening of endocervical crypts. The second feature is Nabuthean follicles. During squamous metaplasia, squamous cells may cover functional columnar cells, and mucus secretions may accumulate inside, forming a cyst called Nabuthean cyst. Clinically, it looks smooth, clear, white or yellow rounded elevations on the cervix. During ultrasound examination, it looks a well-defined anechoic rounded areas along the endocervical canal. And finally, there are three types of transformation zone. Type 1. The transformation zone is completely ectocervical and fully visualized during colposcopic examination. Type 2. Transformation zone has endocervical component but is still fully visualized. And in type 3, the transformation zone has endocervical component and the upper limit of transformation zone is not visualized during colposcopic examination.
Ang take home ko na lang dito sa inyo is again a reminder, no, na when you read your via, you always have to understand first your transformational zone, no? Kung ikaw ay may colposcope gamit nung tulad namin, no, probably you may able to see, no, na Bothian cyst more clearly. Remember na Bothian cyst are minsan puti, are minsan yellow. Akala mo these are positive, pero in reality hindi naman, no. Also the crypts, no, yung crypts na it's a sign na nandoon ka, yung nakikita mo is the transformational zone. So that is the significance ng transformational zone. This is where most, if not all, precancers can be found.